Primary health centers are the backbone of healthcare delivery, especially in rural areas. Serving as the first point of contact for residents, these centers provide accessible, affordable, and government-supported healthcare. In the FCT, over 300 primary health centers are strategically located with a significant number in rural communities where they serve as critical lifelines. Baby Community, home to over 200,000 Gbagis, is primarily a farming settlement. At the heart of this community lies the Kobi Primary Health Center, the only health facility serving Baby and 4 neighboring communities. For over 2 decades, this center has provided vital services including vaccinations, disease prevention, childbirth assistance, health education, and basic medical care. However, the Kobi Primary Health Center is now in urgent need of government intervention.
This hospital was built by the former chairman Amak Area Council, who is now the Minister of Humanitarian Affairs, Honorable Zafania Gisalo. We have been trying to provide needed materials for the facility. Also, we have working towards improving sanitation. Sometimes we even use our own money to ensure it is clean and functioning. But now it needs government intervention because things are not in order again. The community have been trying to put their money to maintain the facility because this is the only hospital that serves here and neighboring communities.
The Traditional Council of Baby underscores the critical role of primary health centers, emphasizing that its proximity is essential for maintaining public health. However, they express deep concerns about inadequate funding and poor working conditions.
We lack much staff, and this is the most challenging the way, because one is that if the health center that is in place of this Kobi community that consists almost about 3 villages, we only have 1 in charge and almost with only 2 staff, and there must be a staff that maybe they will be doing shifting. We have night and here and there. And even if we should go to night, there's no electricity, there's no power electricity in the health center. I think this is what we are passing through, because sometimes if someone fell sick in the night and we want to see, maybe we'll channel the sick one to that place, you see there's no electricity, the staffs are not there.
And that is why I'm saying that we need to upgrade the health center to be upgrading, because at times when we fall in the victim of sickness, before reaching Asokoro, it will be a tough war. And if we live here to Asokoro, it's almost 5 kilometers. Reaching there, it will be a problem. But when we have a closer upgrading health center, it will help us a lot and to go away for far away places.
Mrs. Marco Sunday, the assistant nurse in charge, has served at this facility for over a decade. She highlights significant challenges such as inconsistent electricity and the lack of essential utilities, which severely hinders the center's operations.
The renovation of the facility, as you can see, is linking the office. If there is rain, all this place will be wet, and or even the other reception is linking. So we need government to renovate this facility to us, and we need quarters so that, in fact, if we have quarters here, we will be running shifting, because we do close by 4 o'clock. And when we have patients, because I live in this community, sometimes I close around 5 or 6 o'clock. So we do come back to attend to them.
Some community volunteer health workers voiced their frustrations with the government's neglect in making auxiliary staff permanent.
Even the work that staffs will not be able to cover alone. The volunteers take over and make sure that things are going well in the facility. But it's annoying when you know you are working, you don't have a base. Tomorrow you don't have what to stand for, and you are not expecting anything. From the beginning, they will tell you you are not expecting anything, and keeps on going like that. At a point, that courage, if the courage is not there, something to encourage the person to continue. At a point, the person will now look, there's no point me wasting my energy and my years in service here. The person will decide to.
The time when I start this work for this village, we don't do work, no payment. We just continue like that. As we come, don't come start pay us 7,000, and we dey collect like that. We come, we dey do work. Sometimes we go come, no water. Sometimes we go carry our beds, go river, go bring water for this clinic to do work. After that, we come with the work. No hand glove that we can wearing use to do work. We don't do it like that.
Despite these challenges, the dedication of the staff is evident. Patients like Mrs. Florence Timothy, who is attending her third antenatal care visit at the center, commends the efforts of the workers. Mrs. Timothy emphasizes that despite the facility's limitations, the care provided keeps her coming back.
In fact, this hospital, they used to help us very, very well. They used to attend to us very well, because my first child, I gave birth to her here, and the second one, this is the third one. In fact, they are nurses, they used to try, and they used to take care of us very, very well.
Public health expert Mrs. Juliet Alabra underscores the importance of equipping primary health care facilities to reduce referrals to secondary and tertiary centers.
When the primary health care center is properly equipped, it will reduce referral rates to the state government and also the tertiary institution. If the primary health care center is properly equipped, it will also reduce maternal and child mortality rates. The primary health care center needs to be equipped, not just equipped, but equipped with medical staff, with hospital staff. The nurses and the doctors should be equipped by sending them for in-service training to improve on some medical skills that will help them to carry out their work effectively and efficiently.
Established over 20 years ago, the Kobi Primary Healthcare Center is the only facility servicing over 5 surrounding communities. The staff stress the need for regular supply of drugs and resources. It is therefore crucial that this vital facility is adequately equipped, as it is the center of healthcare for men, women, and children in this community. Naomi Oleribe.